Saturday is World Stroke Day. It's a day that's set aside to raise awareness about stroke prevention and treatment. It's also intended to make sure stroke survivors get the best possible care and support. 2822 Eyewitness News Health Beat reporter Mark Killer is here to explain. Mark?
Nick, a stroke can strike regardless of your age, existing medical conditions, or how physically active you are. I had my stroke nearly 8 years ago when I was at home, but a news anchor suffered one on air recently, showing how a stroke can happen to anyone at any time.
The Tulsa Air and Space Museum is hosting a launch today.
Multiple Emmy Award-winning KJRH journalist Julie Chin suffered a stroke in September, which she never saw coming.
That was a very good example of how suddenly a stroke can strike, and that's why it is so important for us to visit with our doctors and look after ourselves.
While not all strokes are preventable, cardiologist Fahmi Farah says 4 of every 5 are.
So eat healthy, heart-healthy food and exercise, very important. Stress management, very important.
Knowing how to prevent a stroke is not all that's important. Knowing the warning signs of a stroke are too. Think of the acronym BFAST. Sudden trouble with balance or coordination, blurred or loss of eyesight, face drooping, arm weakness, slurred speech, and time to call 911.
A lot of times people wait too long to seek help, and it's really important to recognize the signs and symptoms.
Besides ignoring the signs of a stroke, Tricia Lathrop says another mistake is driving yourself to the hospital. An ambulance which can take you there can do something you or a loved one driving cannot.
You can get treatment on the way to the hospital so that we can notify the hospital in a very timely manner so they're prepared when you get here.
Roughly 800,000 people in the U.S. each year suffer a stroke. The National Institutes of Health reports about 137,000 of them die. It's why Dr. Farah urges this World Stroke Day to take steps now and prevent what might be a preventable tragedy.
Don't ignore your risk factors like high blood pressure, high cholesterol, and diabetes.
Clot-induced strokes make up the majority of strokes. The ones called TIAs usually resolve themselves within 15 minutes, but other strokes require intervention like medication and even surgery. Head to pahomepage.com to learn more about strokes, and do yourself a favor for World Stroke Day. Memorize the warning signs. Nick?
Great advice. All right, Mark, thank you.